Hi, I'm Dr. Ross. I'm a psychiatrist, and I have 3 patients coming in later today, each with a different diagnosed mental health disorder. One has anxiety, one has depression, and one has bipolar disorder. They all have similar treatment-resistant symptoms, and I have a treatment that may work for all of them. In this field, it is important to consider multiple treatment options at once to ensure the most relief of symptoms. Before we discuss the treatment options, let's review each of these disorders, starting with generalized anxiety disorder. Generalized anxiety disorders, or GAD for short, are among the most common mental disorders in the United States. GAD affects about 3.1% of the adult U.S. population, which is about 6.8 million people. It can negatively impact the quality of life for a person and interfere with daily living. Family upbringing, traumatizing life experiences, and biological factors can all lead to the development of anxiety. The distinction of GAD is characterized by uncontrollable, excessive worry that also consists of unexpected panic attacks. Panic attacks are sudden and intense feelings of anxiety that result in difficulty breathing, shaking, and a variety of other symptoms. Many patients never get diagnosed and remain untreated as their condition worsens. Anxiety can range from mild to extreme that consists of symptoms such as trembling, tension, dry mouth, sweating, heart palpitations, hyperventilation, trouble concentrating, and sleep disturbance. Anxiety disorders are distinguished by neurological disruptions. Neurological disruptions are alterations to the brain structure or neurotransmitter signaling that can result from environmental experiences and underlying genetic predisposition. People that suffer from GAD undergo similar symptoms to other mental disorders, and it can be regarded as a disorder that covers a range of moods rather than an independent disorder. Anxiety is commonly confused as plain stress. Stress and anxiety are both part of the body's natural fight or flight response in the brain. Anxiety has triggers that may not be noticeable or detectable. It can be a feeling of distress even before a significant event occurs. Anxiety is not normally associated with a positive emotion. It is constant with no real threat present. For example, an ongoing worry about finances can create anxiety and exhibit the symptoms we discussed earlier. In stress, the feeling will go away after a situation is resolved. In anxiety, the feeling does not go away. Stress can either be good or bad. For example, when you are riding a roller coaster or getting a promotion, you will feel this good stress when you are excited. Overall, anxiety is a disorder that inhibits a person's quality of life, can occur at any age, and treatments include counseling and medications. Our next patient has major depressive disorder, or commonly known as depression. It is one of the most common mental disorders affecting 300 million people of all ages globally. The economic burden of major depressive disorder among adults in the U.S. is an estimated $236 billion in 2018. Surprisingly, half of depression diagnoses are adolescents. People can develop depression as young as childhood and as old as late adulthood. Major depressive disorder occurs in all ages and populations. It often presents with physical symptoms, primarily fatigue, pain, or sleep disturbance. It is considered a chronic disease, meaning it is long-lasting in its effects. It is common that symptoms of major depressive disorder will return if proper treatment is not followed, and the number of episodes will eventually increase. Major depressive disorder, or simply depression, can be defined as a mood disorder that causes a persistent feeling of sadness, loss of interest, and a lack of motivation to do activities one once loved. The development of depression is caused by stressful or upsetting life events such as death or loss, abuse, certain medications, and/or conflict. People that develop major depressive disorder at such a young age have poor cognitive performance in school, including substandard performance of function, processing speed, and memory. This is because the symptoms of depression overpower a person's ability to function normally. One feeling that depression can commonly get confused with is sadness. Similar to the differences of stress and anxiety, depression is often a long-lasting feeling that doesn't go away until it is treated. Sadness is usually triggered by certain events, but once the effect of those events pass, the sadness will go along with it. To reiterate, sadness is a normal emotion that everyone experiences, and depression is a mental disorder that affects people's feelings and perceptions. An example could be a student experiencing sadness because they didn't pass their exams that they had spent a lot of time studying for. Depression can manifest in different ways, including the feeling of unworthiness or hopelessness. Conclusively, depression is more than just normal sadness. It inhibits a person's ability to enjoy their life and be motivated to do activities they once loved. Bipolar disorder is the next and last disorder we will be discussing before meeting our 3 patients. Bipolar disorder is a serious mood disorder that is characterized by manic and depressive episodes that may last for weeks or months. Approximately 46 million people around the world suffer from bipolar disorder, including 2.8% of the U.S. population as of February 2022. The economic burden of bipolar disorder in 2020 was more than $195 billion in the U.S. This disorder can start to develop as early as 15 years old and rarely after 40. Approximately 10% of patients with bipolar disorder commit suicide, and the average life expectancy of bipolar disorder patients shortens by about 15 years. In a more neurological point of view, the overall brain volume decreases, meaning there are fewer connections between neurons. Communication from the central nervous system, or brain, to the peripheral nervous system, or nerves in the body, can be compromised. Bipolar disorder also causes reduced global white matter in the brain, which is found in deeper tissues of the brain that contain many nerve fibers and extensions of nerve cells. If this matter is reduced, there is a reduced nerve flow to the brain tissue. Bipolar disorder is a lifelong disease that makes it very difficult to carry out day-to-day tasks, work, go to school, and maintain relationships. The 2 stages of bipolar disorder are crucial to the diagnosis. The depressive episodes of bipolar disorder are vaguely similar to the symptoms that occur in depression. These depressive episodes are characterized by long-lasting feelings of sadness, including low energy, low motivation, and a new loss of interest in normal activities. A manic episode is characterized by a significant elevation of mood, but changes in behavior can also be recognized. During manic episodes, patients can have reduced need for sleep, reckless spontaneous behavior, rapid speech, and grand thoughts and beliefs. The transition between depressive and manic moods may also lead to suicidal thoughts or actions. The depressive episodes have been shown to overpower the manic phases of this illness. These episodes lead to more suicidal actions compared to mania. Bipolar disorder is a complicated diagnosis considering the 2 phases, depressive and manic. Similar to anxiety and depression, bipolar disorder inhibits the quality of life for a person, and it may make them feel like they have no other option but to end their life. Now, we have reviewed the 3 disorders. It looks like our patients have arrived. Hi everyone, this is my new resident. Would you all mind introducing yourself to them and talking about your diagnosis?
Hi, my name is Jim. I'm 46 years old, and I have generalized anxiety disorder.
I'm Sarah. I'm 18 years old, and I have major depressive disorder. It's nice to meet you all.
Hi everyone, my name is Liam. I'm 32 years old, and I have bipolar disorder.
I gathered you here today because you all have similar treatment-resistant symptoms, and I believe I have a treatment option that could work for you. Just so we're all on the same page, could you 3 describe your symptoms?
On my current treatment plan, my panic attacks have gone away, but I still suffer from repetitive thoughts and sleeplessness.
I've been on antidepressants, and they've helped tremendously with my suicidal thoughts, but I lack motivation and have trouble sleeping every night.
Through therapy and medication, my symptoms have significantly reduced, except for my lack of sleep, similar to all of you.
It sounds like you all have something called insomnia. Insomnia is broadly known as a disorder in which a person has difficulty sleeping. This sleep disorder can make it hard to fall asleep, hard to stay asleep, and can cause a person to wake up too early and not be able to fall back asleep. It is present in children, adolescents, and adults. Insomnia affects an estimated 1 in every 3 adults worldwide. For example, in one city alone, the economic burden of insomnia can be up to $6.6 billion.
Insomnia is a common symptom of many mental illnesses, including anxiety, depression, schizophrenia, bipolar disorder, and attention deficit hyperactivity disorder. The biology of insomnia involves environmental, genetic, behavioral, and physiological factors that contribute to the overall hyperarousal. Stress, unfamiliar sleep environment, jet lag, shift work, or poor sleeping environment can cause short-term insomnia. Mental health issues, the more internal factors, can cause more long-term insomnia. Certain traumas can also contribute to a lack of sleep. People spend many hours staying up and contemplating the past, keeping them from sleeping. Insomnia works concurrently with other mental disorders to worsen the quality of life in a person that suffers from both disorders. A number of treatments and personal therapy have been used to help with the symptoms of mental disorders. Cognitive behavioral therapy, also known as CBT, is an example of one of these treatments that has been researched and targets specific thoughts, physical symptoms, and behaviors. In CBT, preparations are made in order to avoid mental illness symptoms. CBT is an effective treatment against generalized anxiety disorder, leading to significant reductions in worry. CBT was also shown to improve symptoms of insomnia compared to a placebo group. This study also showed that antidepressants and CBT worked concurrently to minimize insomnia and depression symptoms. In youth, suicidal thoughts caused by bipolar disorder also decreased. Youth seem to be more responsive to CBT in bipolar disorder patients. Adults had beneficial effects, but they were not as significant. CBT is a great treatment option, especially when it works with other treatments, such as medication. I hope that all the information I presented you about CBT shows it is an effective treatment. Do any of you have questions? You said that youth were more responsive to bipolar disorder treatment. Will it still work on me? Yes, studies have shown that CBT is effective in adults, but it is more effective in children with bipolar disorder. Are there any downsides to the treatment? No, there are no downsides. If the treatment isn't working for you all after a 6-week period, we can talk about alternative treatments. Any other questions? Okay, now that we've all discussed the treatment option, I'm going to refer you to a CBT specialist we have here at the clinic. I will check back with you in a few weeks to see your progress. Thank you for coming in today. Thank you, Dr. Ross. That sounds really good. I'll see you in a few weeks. Enjoy your weekend. I'm really glad we got to meet with our patients today, and I hope you learned something from this experience. I've been doing research on the best treatment options that can be used with other medications and treatments. I think CBT is a really good option and hope the patients can benefit from it. Oh, I think I hear our next patient.